fourth episode of our six-part series of conversations, where we look into the impact of technology and engineering in a post-COVID-19 new normal. My name is Chitra Sethi, Managing Editor of Mechanical Engineering Magazine and ASME.org. Today's conversation will focus on making robots ubiquitous post-coronavirus. One consequence of the COVID-19 outbreak is the emergence of mobile and autonomous service robots in hospitals, clinics, and factories, where they help produce medical supplies. Their work also ranges from disinfecting rooms and equipment to automating the production of personal protective equipment and ensuring social distancing protocol. Today's conversation focuses on the use of service robots during the pandemic and how manufacturers, hospitals, and supply chains will use these robots to scale up operations quickly and into the future. Joining me today are three guests who will discuss how robotics is addressing the challenges posed by the pandemic. Our first guest is Dr. Howie Choset, who is a professor of robotics at Carnegie Mellon University, where he serves as a co-director of the Biorobotics Lab. Howie's research group reduces complicated high-dimensional problems found in robotics to low-dimensional, simpler ones for design, analysis, and planning. His work in medical robotics pushes the state of art in minimally invasive surgery. Howie co-founded MedRobotics, Inc. to commercialize this technology. Recently, his snake robot cleared the FDA and has been in use in the US and Europe since. In 2015, Howie co-founded a company called Heavy Robotics to commercialize the modular robotics technology to accelerate the development, programming, and development of robots to work with people in manufacturing facilities. Our second guest is Haggai Balshai, the CEO of Israel-based Robotican that focuses on the development and integration of autonomous robotic platforms. Haggai is an MBA and MSc in mechanical engineering with a specialization in robotics and control. He's an expert in the field of robotic mobile systems for defense applications, leading Robotican in the fields of mechanical design, precision control products, and robotic sensors. Our third guest is Dr. Mark Stibich, an infectious disease epidemiologist who is the chief scientific officer and co-founder of Xenex, where he focuses on scientific R&D, new technologies, and protocol design. Powered by the Pulse Xenon SureStrike 360 technology, the Xenex LightStrike germ zapping robots provide no-touch disinfection used in more than 400 hospitals. Mark has published more than a dozen scientific papers on ultraviolet light and healthcare-associated infections, and he holds more than 90 patents on infection control approaches. He holds degrees from Johns Hopkins University and Yale University. Well, welcome everyone to our Rebooting the Pandemic conversation.
Thank you. Happy to be here.
Thank you very much. It's a pleasure.
So robots have long helped humans by doing tasks that are too dangerous, too difficult, and too dull. As nearly every hospital in the United States, Europe, and beyond became a disaster zone when COVID-19 hit, robots took over dull, dirty, and dangerous jobs, freeing doctors and healthcare workers to do more critical tasks while keeping them safe from this highly contagious disease. There are several areas where robots made a difference over the past few months in response to COVID-19. Howie, how have you seen roboticists join the fight against COVID-19?
So robotics people, a lot of us have been thinking about disaster response for some time. You know, the person we should note is Robin Murphy, who's probably the biggest thought leader in the field here, and certainly she's influenced my thinking. So it's not that hard to see how the robots and the ideas and the concepts for search and rescue can apply to the COVID-19 pandemic, because it's like a disaster response. However, we're also seeing the use of robots, say, that were used for logistics, also be applicable here. And we're seeing the use of robots for, say, telepresence also being of use. You know, for example, if we can protect the, or maximize the distance between the caregiver and the patient, that does a world of good. You know, there are a lot of things where perhaps a healthcare provider can stand in a doorway in a hospital room and instruct the patient what to do with a robot, or the healthcare provider can be at a completely different location. It's a shame that a healthcare provider would have to get sick in the process of doing her or his job. And I might add, it's a shame for us too, because that's a limited resource. The thing we should also note is that it's often a fun question to ask, what's a robot? And I don't want to get into that right now, but there's a lot of robotic technology, a lot of robotic concepts that also can apply here. Perhaps we can build new types of ventilators, new types of other systems that use robotics ideas, the sense, plan, act paradigm, to make something that's both useful, cost-effective, and something we could obtain in the near future.
Mark, sterilizing hospital areas quickly, reliably has always been a challenge, but during the coronavirus pandemic, it became in some cases a matter of life and death. What has been Xenex's experience in solving this pressing problem of disinfecting hospital rooms?
So before the pandemic, we focused on what we call hospital-acquired infections. So like in the US, there are about 2 million of these infections a year. And a lot of the issue is how the rooms are cleaned. If you picture even a bed or a tray table, it's very difficult to manually clean all of those surfaces. And that's what the robot does. Our technology will basically automate that process and allow for a reliable and repeatable disinfection of the room using this no-touch method. What we saw, as COVID-19 came, we had about 500 to 600 customers at the time. And what we were able to do is help them redeploy those resources. So they might have had a robot for orthopedic surgeries that are now, not happening, because those have been non-essential. So those robots get redeployed into the ED, the emergency department. They get redeployed into screening areas and respiratory care areas. And really what, our slice of this, our piece of this is to reduce that environmental risk. We know that the SARS-CoV-2 virus can sustain on surfaces. We know that can be viable for days. We know that a person who's infected with COVID-19, it contaminates the environment quite a lot. And so that's where the robots come in. What was interesting is that many of our hospitals decided to do 2 protocols. So normally they would clean the room and then use the robot as the very last step to disinfect the room before the next patient comes in. Many hospitals decided they wanted to do 2 protocols, which is send the robot in first, let it disinfect, just not as perfectly as before, but we're going to get the air, we're going to get the surfaces in there. And that makes it so much safer for the environmental service worker, the cleaner who's going to come in after. And so we're going to change that environment they're exposed to, let them then do their job, and then we're going to zap a second time, to follow up in case they might have missed a surface and that's what we saw happening. So we actually saw additional disinfection cycles in some cases. And now we're seeing the robots deployed more into new areas of healthcare for us. We're predominantly acute care. And now we're doing service calls for nursing homes. And then moving actually out of the healthcare sector entirely as airlines and transport and hotels come back online. So there's interest there as well.
Haga, your team at Robotican adapted an existing autonomous platform to operate within coronavirus wards so that doctors on the front lines wouldn't have to be in direct contact with the patient. How did that come about?
We use a robotic platform that we previously developed, and as Awi said before, we are using platform for all sorts of things in every day. And this is what Robotican is doing. And basically, we didn't anticipate this pandemic and the way that it will go. So what we did here in Robotican, we used platform that we are already using in other types. Some of them in the agricultural field that we assemble and basically change for the usage in hospital. We use another type of platform, autonomous platform, that we use in supermarkets. And we convert them for being able to use in the environment. And we saw immediately a great response and a great ability to use those platforms. And again, as Mark and Howie said before, the thing is to prevent the staff, doctors, nurse, and everybody basically to be exposed to the virus. So if you can use robotic platform and the robot stayed inside the contaminated area, they basically kind of been in the gap, and basically you need less to be extract to the virus. So we use already existing platform. We did some kind of twists. We worked with the doctors and the staff to know what they need, and being able to deploy it really quickly because it was already existing. So yeah, definitely, definitely a good place to use robotics these days.
So COVID-19 has generated a lot of interest in robotics, drones, and AI. So as the pandemic recedes, do you think the interest in robots will continue to grow? Javi, why don't we start with you? What do you think about that?
You know, the truth is, I don't know if the interest in robotics will grow or not because of the pandemic. It's natural to think it would because there's so many clear uses of robotics technology here, so it stands to reason it should. However, there's something about human nature, and I draw from my search and rescue experience. So whenever there's a disaster, the few times there are, I get a call from someone saying, hey, we need your robots right now. So most recently, it was in Mexico City a couple of years ago. We sent robots down at the invitation of the Mexican Red Cross to help clear buildings. But we should note that those were robots that we developed under a different contract where we scraped money together, we spent our own money and so forth. You know, there really was no support, and we were glad to do it. You know, the opportunity to serve is an honor. However, for that week or two, people are like, yeah, we need robots. But after a couple of weeks, people forget. And then when we applied for grant support to advance this technology, it's almost an afterthought. So we're hoping that, and again, we don't want to capitalize on the misery or the suffering of other people, because again, a lot of people suffered and people died. But to quote Mark Cuban, why waste a perfectly good crisis? Let's see what we can learn from this and what we can gain from this to be better prepared for the next one, because there will be one, and be able to improve a reaction. And then finally, beyond the dealing with the sick and the healthcare providers, see how robotics can help spark the economy.
That's a great point. Mark, how has your experience been? How have your customers responding since the pandemic?
Yeah, so I mean, we've seen just a huge surge in interest in the robot and orders. You know, so we're scaling our production and supply chain and everything as quickly as we can. And what we're seeing is new use cases coming up. So there's you know, like hotels and airplane and everywhere else, there's this interest, at least at this moment, in how do we do this safely? How do we, you know, automatically, reliably, repeatably remove the virus from the environment? And that's really where the robots come in, because all the other solutions rely on manual labor. They put people at risk to do this, and the robots can fix that. What I've found has been really interesting, and it's partly some robotics and just some technology, is there are, you know, over the years for Zenix, there's been a lot of projects we've been really wanting to explore. Like, we think, okay, this would be great. These different new technologies could really solve some problems, but we hadn't been able to flip the switch on those products because we weren't sure the market was there. You know, so we're selling the robots into hospitals. There's a clear payment structure with that. There's a clear return on investments. But beyond that, it was very difficult. Now, all those projects are live. Like, so we're able to develop further now because of this market and this understanding in the public of the risks, you know, in our case around disinfection, and the advantages of having robots do that over people.
Hagai, have you seen a similar demand, more response from the market for NurseBot since the pandemic?
Yeah, of course. First of all, here in the local area, in Israel in specific, we saw a good response and a lot of demand for whatever we have. Basically, they were grabbing everything. So yes, definitely we saw that. We also got other clients around the world that we already sold robotics to them. If we can do all kind of help them do the change and use the platform that they already bought for the pandemic. So again, this was as a demand, and they were also asking for more robotics platform to elaborate basically their ability. And I'm really excited to hear Mark saying that, because we had the same thing also, trying basically to put autonomous or robotics in general in hospitals was a really, really tough task. We were trying to do that for a long time. And basically, since the pandemic started, it was like everybody was grabbing whatever they can. They was enabling to do whatever kind of testing and technology that we wanted and able to offer them inside the hospitals. And we saw a huge demand for that, and a really good willing. I'm taking what Howie's saying, that probably the day after, nobody will talk to us. So we decided to grab it as fast, as strong as we can, as long as it will be. And again, I'm surely hope that nobody will get sick or die or whatever. We don't like this, but unfortunately, we're using those kind of times to develop a little bit more robotics, and we try to do it as the best as we can. So yes, we saw a growth, but we're trying to get the best out of it.
Yeah, again, let's not waste a perfectly good crisis.
Yeah, you're right.
A good point there. And like how we mentioned earlier, telepresence robots, we have seen a lot of innovation happen in that space, even in remote medical assistance over the past decade. Hagar, do you think doctors fighting the pandemic, they obviously appreciated the eyes and ears of the nursey bot, but in general, do you see telepresence robotics growing in future?
Yes, definitely. It's a little bit complicated. Everybody wants a fully autonomous platform, and they want it to be the perfect match. And they want that this wonderful robot will do 100 and maybe 120% of everything they want it to do. But in reality, and we saw it with the autonomous vehicles and stuff like that, people starting to understand that might not get everything, but some of it will be sufficient. So we do see it with the doctors after this platform. They saying, okay, we are not getting as much as we want to, but we can do this now and we can do that. For example, telepresence for some specialist doctor in some fields is something that now we are starting to see that it's a possibility now. Somebody can actually support patients from far away, and it's okay. Everybody can get this. So we do see some change in the ability to accept other fields of robotics and lack of fully applications. So we see it grow. We already was asked, because it's not just the medic world that got shocked. Everybody basically, because we saw it also in factories that now employees could not come because either there was a curfew or their kids are at home and they need to stay and babysit or whatever. So you can see that everybody wants some kind of assistant, and exactly this is what robotics can give and can grow with you. Basically, you can do something now for telepresence and get the layers of autonomy evolve with time. So again, we do see a great potential, and we get kind of a boost to robotics. We need just to grab it right.
Howie, would you like to add to that? What's your opinion on telepresence robots growing in the future?
Yeah, I think, let's see how I say this. I think creating good telepresence experience is a very difficult problem. It's the presence I think we can provide is almost comparable to a Zoom phone call. With that in mind, I think given the problem that we have now, users are willing to tolerate a non-immersive experience more than I think they otherwise would have. So with that, I think it's an opportunity because now we can try and start and do some things, not solve complete problems, solve partial problems, and then build on our successes from there. So from that perspective, I think it's exciting as a potential. But again, I use the word exciting couched in the framework that I don't want to take advantage of other people's misery, et cetera.
Really said. Mark, do you anticipate a rapid growth in this area?
Well, what I've seen and what I hope to see is, there's certainly been a change in how we do business and how meetings happen and those cultural changes around there. So as I was saying, I think there's, we have some technology now. I think there'll be a market for it. I think people are I'm less likely to justify getting on a plane for a 1-hour meeting. Why not just call in, and everyone seems to be accepting that now. So I think there'll be an opportunity to do that. In medicine, I think the telemedicine movement, people recognize not only is there a risk to encountering healthcare because there's sick people there, there's infections, but it's also really convenient. And so I think we'll see a lot more push toward that. And so I hope, the technologies are there to improve it already. I would think so. There should be demand. It should come.
Right. You made a good point about, people accepting a lot of things now in this new reality. So as the coronavirus recedes, as Hagai mentioned earlier too, factories and workspaces, when they open, there could be shortages in staffing, or people might not be able to still go to their locations, or there might be holes in the supply chain. What do you think the role of robots, what role do you think robots will play in filling that gap at workspaces, at factories, or other locations?
So, factories and distribution centers, they're different beasts. So, in terms of factories, some factories already have robots, automation, doing assembly, but still, people are also doing assembly and supporting those robots. I think in the short term, what we're going to see, in addition to more social distancing, is the use of robotics and vision technology to make sure people are maintaining social distance, following what flows or paths they should follow in their environments, et cetera. In other words, the phrase we use sometimes is that there'll be more big brother watching us to make sure we're doing fine. And again, I think we'll be more accepting of it. Where I see that the use of robots in those environments, and again, we're just talking about the factories, is that there's a lot of tasks where a person has to go fetch something. And it's something that should have been automated anyway, where the line worker, the associate, shouldn't have to go to what they call a supermarket. It's a collection of parts in the factory where they get things. That's something a robot can go and do anyway. And it's something that I think would have improved automation, but now I think companies will be more likely to bear the initial investment because they'll have the added bonus of minimizing interaction between people. It maximizes that offset distance. Likewise, in warehouses, a lot of that still isn't automated yet. There's obviously, the Amazons of the world, the Berkshire Greys of the world are leading the charge there, and they have automation in place. But I think we're going to see greater adoption of those technologies as we try to, again, minimize human contact and interaction in these spaces. Where I would like to see the automation go is that final mile, from the truck to the home. I think that there's a lot of potential there. I don't believe we're going to see drones picking up packages from distribution centers and flying all the way to your house anytime soon, but maybe a drone flying from a truck that's parked on a block, we may see.
Mark, do you anticipate robots playing a greater role in factories?
So in factories, certainly, automating the processes. We're also seeing demand, and we're having a lot of conversations on how do you disinfect large spaces. Pieces of boxes, supplies, parts are coming in from all over the world, and there's a concern there with the employee base and everyone, workers and management, corporate, everyone's like, what is that now? There's this really acute awareness of sort of this interconnectivity, and this box could have been touched here. What happened to it? and trying to figure out, there are just vast spaces for disinfection, and you have all sorts of different types of materials. So we're having a lot of conversations, and how do we disinfect and automate that disinfection to make sure the workplace is safe? And then, moving from factories into workplaces, we see the same thing. Like, even in an office environment, what happens if, someone, we reopen, and then someone doesn't come into work that day because they're sick? All of a sudden, everyone's very, very nervous. And so to be able to automate the disinfection of that person's flow, to know where they were, make sure we disinfect it, and without creating a theater, but making sure everyone's aware and comfortable that this is happening, so they can feel confident going back to work. The same thing with all the transport, other issues like that. As this reopened, how do we instill confidence and do it without putting people at risk? The people who have to do that disinfection, how do we keep them from being put at risk? So it'll be very interesting to see how this all comes together in reopening.
Right, it'll be interesting to see how it all plays out. What industries do you think will rely more on robots going forward?
Of course, I think that places that have a lot of human labor will try, at least, to use as much robotics as possible, because again, social distancing and stuff like that will be easier to monitor, easier to control when you're using robotics. As human and as nice as we're trying to be, we are not as good at that. So I think with able to use robotics, this will flourish. I do want to mention one thing about what Howie was saying about drones, that we can see them taking last mile or even more, all kind of packages and stuff like that. We used to think that the thing is regulation. Basically, we don't see drones today that we use because of the problem of regulation. We don't want something like a drone flying up above our heads. But if we are staying at home most of the time, and at least in Israel, what we saw, that the roads are empty, people are not walking on the streets. So basically, these kind of things also got changed. And if you are already changing your mind, you might be more open to use autonomous drones for last mile delivery and stuff like that than we used to be before the pandemic. So this is another thing that just mentioned. I'm not sure that it will happen. From some reason, I still hold the same thought that Howie is, but I'm trying to train my brain to think differently. One last thing. Sorry?
I'm sorry. So you raise an interesting point there, and that is, in the United States, there's going to be all these stimulus packages. And I think what we should be doing, let's say stimulus for infrastructure is an example of that. And I think what we should be doing is not rebuilding the same thing. I think now is an opportunity to have a reset and open our minds and think differently. So when we do go and use this money to stimulate our economy, like for example, again, I'm using Mark Cuban's lead here. Instead of just building a new road, let's build a new road with sensors in it, so it's better for autonomous driving cars, for example.
Definitely. And this is another thing that I want to mention, that we are now in the revolution of the fourth industrial revolution. I'm pretty sure that some of you heard about the phrase of the fourth industrial revolution, and we are already trying to think about the fifth one. And when we are talking about the fifth one and talking about the pandemic, or the most, big thing that we saw, that the skies were closed. Nobody was flying nowhere. Getting supplies from countries to countries was a real big thing. Here in Israel, and I'm not trying to scare anybody, but even we got to use the army facilities, not the army itself, but the ability of the army to buy stuff and bring it back here to Israel for being able to transport goods. And the industrial fifth revolution is talking about being able to locally produce whatever you need, basically to be able to, we were used to talk about customization. Everybody wants his own thing, whatever he wants, whatever he like. And we want to really, the ability to be flexible and being able to customize things. So we can also add this to being able to produce whatever we want in each country. And this will be a really big change for a lot of us, because now most of the things that we are producing is in third world countries, China, for example. And we had a really big lack using these places on earth to produce. I think this change and the concept itself for being able to customize production and self-product will be one major role that will evolve from this pandemic. So this is my thoughts, but again, it's only trying to think out of the box.
Sure. So, when I picture an engineer shoulder to shoulder with a robot to assemble a part in a factory, or a human nurse, say, supervising a crew of medicine delivery robots, even a humanoid bot interacting with a child, I also imagine conflict or see chances of things going wrong. So as the human-robot interaction increases as we move forward, what will be some of the challenges associated with it, and how do we address those? Do you want to comment on that?
Yeah, there's just so many things about that which are obstacles, certainly not insurmountable, but there are obstacles. Now, I usually think, and no offense to your question, of course, that those questions are based on us watching science fiction movies. No one thought about the robots taking over. Well, they should have, because they should have seen the previous movie. However, it's more likely the case that if we have a robot out in the field, that some minor malfunction will cause an arm just to go like this real fast and hurt somebody. That kind of safety analysis, that kind of failure analysis, which we're good at doing as a group, still needs to be better thought out, because in the end, there's always going to be an edge case. You see, these robots have to be 99.9999999, however nines you want, % safe. And ask yourself, when you talk to Siri or whatever the Android version of Siri is, what's its success rate? And it's not that high, and that's a much easier problem to address. So all I'm trying to say is, I think we're all aware of the high-level considerations. I think we're also aware of the mid-level ones, the actual interaction, which there are a lot of great people studying these problems. And of course, the risk of promoting my colleagues at CMU, Henny and Donnie is a good person. Her work is amazing. But it's those low-level considerations I think we often overlook. And that's really where I think we're going to have to make sure we're safe there before we think about the other problems.
Hagai, do you agree with Howie, and would you like to add more? Mm-hmm.
Yeah, I definitely agree with Howie. He's right. But what I do want to add that we are not in the research world, and we do try to be more pragmatic about robotics. And I don't think that we are looking for almost 100% solution. We're trying to take the good things out of robotics, and today we are not doing we're taking the malfunctions out of the equation, basically. So again, there is some autonomy that we can see that works together with collaboration with humans. We will give that. And the places that we do see that a human attendance is needed, instead of the robot will get his own wrong ideas, or basically a wrong path, we are trying to stop that in advance and give somebody to get the decision for the robot. And I'll give a quick example for one of them is working in the hospitals. The robot can go to room number 3, can go to room whatever. He can try to go to the bed, but if you'll block his way with all kind of stuff that we are human are really good in inventing, he probably won't be able to go all the way to this or whatever kind of patients. But in this case, we do kind of a small alert to the nurse and saying, okay, we got so far, please give us, we can, I don't know, run through this pants and go through or not, or something like that. And we're not trying to solve 100% of the problem. We are giving maybe only 80, 60% of it, but still it's something that will help them So these kind of things can do collaborate and work together. This is the thing. So it's not the perfect idea, it's not the perfect world, and as Howie said, we need to be as certain as possible that we won't run nobody, we won't eat nobody with a robotic hand. So we don't try to solve them. If we see a person, we first stop. We don't try to do all kind of really smart maneuvering with him. We will stop. Okay, it will take more time. We can neglect that if the overall objective will kind of increase or decrease the volume of what we are doing. So this is basically the idea. This is my thought. And again, I'm coming more from the commercial point of view and not just the research point of view. In the end, we're trying to do some kind of a business out of it.
Sure. Mark, what's your opinion on it? Can humans and robots be companions in a post-pandemic world?
Yeah, so we've actually experienced this quite a bit because we've put thousands of robots in hundreds of hospitals, and they're typically they're used by the environmental service workers, the housekeepers, and when we first come on, like when we're in the purchasing process, we learned early in the company, like these rumors will get started, like, oh, the robots are going to replace our jobs, and then we've actually had some programs. I won't exactly say sabotaged, but utilization was not as high as goals because people felt the robot was a threat. So we've created programs to kind of alter that. So one of the first things we do, and this came from one of our early hospitals, is when we bring a robot in or multiple robots in, there's a naming competition. So they name the robot. And then facility, we have all these great stories. Facilities have gone and hospitals have gone and adopted the robots. We've got pictures of them taking the robot through employee training. They make a badge for the robot, and they're really, we're really emphasizing, this is your new tool. This is your new team member. And my favorite story is there was a children's hospital, and they had a robot, and it was named Alan after one of the workers there. He got the naming, and we kind of made it blue because it was a children's hospital. And then a year later, they got a second robot, and they named it Annie. And they had a wedding. They had a robot wedding when they got the two robots in. And it was great. And really, when we see that, we see utilization go way up. We see everyone heading their compliance, heading their protocols. So it's a lot of the context given around bringing that new technology into their workflow. And what we like to tell them is, the pathogens have evolved. They're more dangerous than ever. And, without the robot, you're still expected to clean with a bucket and a mop and a wipe and make this room safe. You need a new tool. You need a new partner. You need a new team member. And that's what we're bringing to you. So you can do your job better and you can be more effective. And when we bring all that together, it meshes just beautifully.
Excellent. So last question.
I think also,
sure.
if I can add of what Mark's saying, and I also saw your TED Talk, which was brilliant, I must say, on the same topic. But I think it's expectation. If you know where to put robotics and what they will do, I think this will clear it out. And again, don't accept that to do 100% of the things, and it will do as a tool what it's supposed to be done. And I think this is a key factor here.
So to wrap it up, I have just one last question. When the world returns to some semblance of normalcy post-pandemic and robots become more and more ubiquitous in future, with all of these technological advances, do you think we will be more prepared for a pandemic like COVID-19 if it ever happens again?
I do believe we will be better prepared for the next pandemic, period. Clearly, we're going to have more face masks. We're going to have our ventilators lined up. I think that kind of preparation we'll do better next time. I hope we do maximally better next time and we learn as much as we can from this experience because we don't want to waste a perfectly good crisis. However, I think the other point that was raised, which I think is more interesting, is did we learn anything new about how to respond to something that's unknown and completely new? And it's not clear that we learned that. Maybe it's impossible. I don't know, but that's my fear. My fear of the unknown. And I don't know if we've learned too much. For what it's worth, I think it's inevitable. There will be another one. I think the recent history has shown about every 5 years a new virus comes out. they've been getting worse each time. Of course, we only have 3 data points, so maybe, or 4 data points, so we can't generalize, but there will be something else. In terms of, did we learn anything from a robotics perspective? I know I have, I believe my colleagues have, people I talk to have, but collectively, we'll be able to learn as much as we could. I don't know. And I hope that whatever robotics can do to serve and help these causes, it'll be cost effective and easy to implement, so we can be ready for the next time. But again, that goes down to how are we going to spend our time and our limited resources over the next few years preparing for that inevitable next virus.
Mark, your final thoughts on how you envision the future with robotics post-pandemic.
Sure. So first, as an infectious diseases epidemiologist, sadly, I have to say that just because we're having a pandemic now doesn't change the probability of a pandemic in the future. The viruses don't know that we have a virus now, so the chances of something recurring are the same or higher as populations get larger. I think we'll be more prepared, but we won't be prepared as we need to be, nor will we be prepared as we could be. There's a lot that we could do and need to do. We'll be better off, but not perfect and not nearly where we need to be. And so I'm hoping what we see an investment in what I'll call the infection control infrastructure that will not only benefit for the future pandemic, but we have infections every year. We have hospital-acquired infections. We have superbugs. We have antimicrobial resistance. We have these problems anyway that overlap with the pandemic. And so the society would benefit by addressing those very, very aggressively, and that would then increase the infrastructure for the next pandemic when it comes along.
This was an insightful conversation, and we could go on, but this is as much time we have for this 4th episode in our series of Rebooting After the Pandemic Conversations. I want to thank again our speakers, Dr. Harvey Chauset, Dr. Mark Stibich, and Hagai Balshai for joining us today. Our next conversation in the series on June 23rd will focus on manufacturing smarter after the pandemic. Also, if you want to learn more about how we will kickstart our industrial ecosystems, watch a video featuring ASME's Executive Director and CEO Tom Kotzebue and Mechanical Engineering Magazine's Editor-in-Chief John Falcioni, where they discuss the role engineers will play in rebooting of our society after the pandemic. The link to the video is in the resource section below. Thank you all for tuning in and hope you join us for our next conversation.